Once upon a time, there lived a man named Muiz, a 77-year-old farmer who lived a quiet life with his four beloved sheep. Every day, Muiz tends to his sheep, cutting and carrying fresh grass from the nearby field and cuddling them whenever he can. It's a bond built on love and care. But suddenly, Muiz was hospitalized for 3 weeks due to his old and tendering age. Without Muiz's daily care, the once thriving field became overgrown. Oh, look! It's one of Muiz's beloved sheep, Maimuna, grazing on the tall and long grass. Let's inspect this tall grass a little further. Oh, it's Brachiaria decumbens, also known as signal grass, which is a topical forage grass. In some regions, it is considered invasive due to its aggressive growth and ability to outcompete native vegetation. Oh no! Brachiaria can cause toxicity to ruminants. Prolonged consumption of Brachiaria decumbens and exposure to sunlight could lead to photosensitization. Photosensitization could lead to several things such as facial edema, erythema, cracked skin, and eventually hemoglobinuria. Brachiaria decumbens toxicity could also lead to neurological disorders such as stamping of forelegs, stargazing, incoordination, and also circling movements. Unfortunately, if jaundice is seen, its next stage would be death.
So, Brachiaria decumbens toxicity. It all starts when sheep ingest too much of Brachiaria decumbens. The primary toxic compounds in signal grass are steroidal saponins, which are metabolized in the rumen. Saponins induce immune cell activation and cytokine release. Saponin metabolites are hepatotoxic due to their membranolytic activity and their ability to disrupt erythrocytes. Hepatic damage leads to hepatogenous photosensitization. This occurs as the liver is unable to adequately remove phytoporphyrin. When retained phytoerythrin encounters sunlight in exposed pigmented areas of the body, such as the ears, the face, it causes oxidative damage in the cells of the skin. The metabolism of these saponins results in the formation of lithogenic biliary crystals that cause cholangiohepatitis, biliary extrusion, and necrosis of the periportal hepatocytes, resulting in jaundice and skin lesions such as erythema, edema, ulcers, and crusty scabs.
Now, let's move on to the diagnostic workups. There are several diagnostic workups that can be done to identify the presentation associated with Brachiaria decumbens toxicity. So first is the blood work. Blood work may include the complete blood count and also serum biochemistry. It should be done to the affected sheep, and the expected findings of the serum biochemistry will include hepatobiliary and also impaired renal function parameters. Hence, we can see increase in several enzyme levels such as BUN, creatinine, AST, GLDH, and also GGT. We can also observe the increase in plasma ethyl index of the serum and also bilirubin levels coincide with the jaundice appearance shown in clinical sign. Next is the postmortem. So postmortem can also be done as part of the diagnostic workup to identify the presence of Brachiaria decumbens toxicity. So grossly, from the general appearance, we can see several lesions associated with photosensitization, which include facial and periocular alopecia, crusting of the muscles, and also necrosis of the ear tips. As for the jaundice, we can see yellow discoloration of the mucous membrane, including the conjunctiva and also gum. Facial edema may also be seen, including at the submandibular region. Now, let's move on to the deeper finding of the postmortem. So from the organs lesion, there are several lesions that can be seen in Brachiaria decumbens toxicity. So for example, for the liver, we can see increase or decrease in size, distension of the bile, liver fibrosis with yellowish distribution associated with jaundice, which is high in bilirubin levels, and also serous atrophy. Last but not least is the histopathology. So from the tissue lesion that we see in the postmortem just now, we can do the histopathological diagnostic workup to further confirm the Brachiaria decumbens toxicity. So the expected findings in histopathology will include severe fibrosis of the liver, biliary duct proliferation, infiltration of inflammatory cells into bile ducts or within the hepatocyte, and also presence of refringent crystals.
With brachiaria toxicity, the first thing we should do is providing shelter and away from sunlight to prevent from exposure or photosensitization. We should also remove the primary cause of toxicity, which is the plants that has overgrown. Supportive treatment can be given, such as antibiotics, to prevent any secondary bacterial infection, as well as anti-inflammatory to prevent from prolonged inflammation as well as pain.
So for the client education, it will include the immediate action that need to be taken by the farmer and the preventive measures to avoid the cases of Brachiaria decumbens toxicity again. So for the immediate action, as we know, Brachiaria decumbens has no treatment, so we need to provide shade or shelter for the affected sheep to avoid the exposure to the sunlight as it will worsen the condition. And also, the farmer need to change the type of pasture or hay that used in the farm and remove all the Brachiaria decumbens grasses from the field. As for the preventive measures, since there are Brachiaria decumbens toxicity cases at the past, the farmer should avoid over-reliance of Brachiaria decumbens as the feed intake for the sheep. They need to introduce diverse grasses and also legumes as feed for the ruminants. If the Brachiaria decumbens is common to be given in the herd, ensure that close monitoring of herd health to detect early signs of toxicity in order to preventing it from getting worse or to cause mortality. That's all from us. Thank you for watching.